Class, hello, and welcome to this counselling session on confidentiality and supervision. I will be your tutor, Big Owl. Today, we are going to look at confidentiality, when you may need to break confidentiality, the importance of supervision, setting up your own practice, and CPD. First, let's look at what is meant by confidentiality. As a counsellor or therapist, you have a duty to keep everything your client tells you in complete confidence, although there are some exceptions which you are expected to report as a matter of duty. These exceptions we will come to shortly. In the assessment and commitment sessions, you would explain to your client the restrictions of confidentiality and reassure them where possible that mostly everything that you are told is in complete confidence. Remember, when you have supervision, you will commonly speak about your clients, although this is not to say you will be identifying them personally. It is important that you explain exactly the obligations you have as a therapist or counsellor to pass on information to third parties. What if a client tells me they were planning to do something illegal? Do I still have to maintain confidentiality, even though by telling the appropriate authorities I could stop them from doing it? You must disclose concerns relating to child abuse, Children Act, a client becoming a risk to themselves and/or others, Suicide Act, a client partaking in terrorist activities, including money laundering, Terrorism Act. Although it is your duty to disclose under the terms set out above that there is no harm in asking for your client's consent prior to disclosing to a third party, explaining that this is something you must do. Remember, you also have a duty to your client and the therapeutic relationship you have built with them. This is where counsellors and therapists can feel as though they are conflicts in their legal and ethical obligations. Confidentiality versus disclosure. This area must be clearly explained to the client. Many counsellors and therapists feel confused when it comes to disclosing child abuse. This is mainly due to the concern of whether we disclose all incidents of abuse, past and present. When talking about this subject, it's important you understand the context. If we are talking of an adult client that was abused as a child, you may wish to ask yourself, is this client still being abused by the perpetrator, and are they considered vulnerable? Alternatively, does this person have access to other children? If the answer is yes to either of these questions, then you must disclose. You, of course, have the option to seek advice and direction from your supervisor at any time.
You mentioned that we would discuss our cases in supervision. What is this? Must we have supervision?
Yes, it will be part of your professional membership obligations that you undertake supervision on a regular basis. This is commonly set at a minimum of 90 minutes each month. The British Association for Counselling and Psychotherapy, BACP, defines supervision as a formal arrangement for counsellors to discuss their work regularly with someone who is experienced in counselling and supervision. The task is to work together to ensure and develop the efficiency of the counsellor-client relationship. The agenda will be the counselling work and feeling about that work, together with the supervisor's reactions, comments, and confrontations. Thus, supervision is a process to maintain adequate standards of counselling and a method of consultancy to widen the horizons of an experienced practitioner. Supervision can take place as a one-to-one session, group session, or peer group session. It is an important part of a therapist's practice and ensures that they themselves stay safe and can discuss any issues that therapy sessions have brought up for them as individuals as well as professionally. Like actual counselling sessions, the issues discussed during supervision remain confidential.
I'd like to be a self-employed counsellor. Is it easy enough to do?
Setting up a private practice requires a large amount of planning and careful consideration of a number of factors. These include the ethical framework you will follow, professional liability insurance, safety issues, finding a suitable therapy room, cost, bank accounts, constructing a website, creating leaflets and marketing material, business partners or solo venture, registering as a business, charity, and so on, creating a business plan. All these need to be carefully considered before a decision to set up a private company is made. It is important to set realistic targets and not to rush to achieve too much too soon.
I was reading about CPD. What is this?
CPD stands for Continuing Professional Development and is an important aspect of a therapist's accreditation with a professional body. The BACP, for example, requires members to complete a set number of CPD hours in order to maintain their accreditation status. These professional bodies provide details of suitable training events which members can attend. The guidelines for CPD are individual to each professional body and use different systems and points. CPD is training that you undertake. Completing this course, for example, doesn't mean that your training is over and you will never need to do any other training to practice. Working as a counsellor, like many other professions, requires ongoing training. It is important to check the guidelines of the professional body you join to ensure you complete the necessary hours of training. If you do not complete the required hours, your membership may not be renewed. To summarise what we have learned today, we have looked at confidentiality, supervision, private practice, CPD. Goodbye, class, and